I'm Lacey Nobles with the City of Lubbock. We're going to start our news conference in just a few seconds. I'm Lacey Nobles with the City of Lubbock. Hi, good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. Today we'll have updates from our panelists, and they include Katherine Wells, Director of Public Health, Dr. Ron Cook, Local Health Authority, and Lubbock Mayor Dan Pope. So let's get started with Katherine Wells.
Good day, everyone. I'm here to update you on our current COVID-19 cases in Lubbock County and also review some changes that are going on with our Patterson Library Clinic. The health department is reporting 406 cases of COVID-19 as of yesterday evening, and we're really pleased to see that 491 of these individuals are fully recovered. Over the last week, the department has continued to report an average of 5 cases a day, and we have the number of active cases has been remaining around 170. These are all really great signs. Even though the numbers are low, there continues to be COVID circulating in the community. We don't want to see COVID re-enter any of our nursing homes or any other high-risk facility. Therefore, we must continue to stay the course. This is a community effort. I want everyone to be smart when you're out, practice that social distancing, and wear a face covering while in public. The health department remains staffed 7 days a week to take provider calls, answer community questions, and process those all-important contact investigations. We are also committed to making testing available in our community. This week, we updated the Patterson Library Clinic, or changed it from afternoons to mornings. This makes it cooler for both staff and patients. The clinic continues to operate on Monday, Wednesday, and Friday, but now we're open from 9 a.m. to noon. City bus service continues to be available. If you want to make an appointment for that clinic, please call the health department at 806-775-2933, and you can make an appointment between 8 and 5 each day. And that concludes my update for today, and I will now pass it over to Dr. Cook.
Sorry about that. I'm trying to get my video started. Here we go. I think you can see me now. Thank you, Katherine. I appreciate that. Let me give a shout out to Dr. Douglas Klepper, who covered for me last week in my absence, and he did a fantastic job. He's a superb physician and very attuned to the community's health as well. So he's a great fill-in, super guy. So we're on day 78 of COVID, and we're doing a great job. Our numbers continue to be low. They continue to smolder, as Katherine said. We want to make sure we keep it there. And so the way you do that is that you stay home if you're sick. If you've been tested, please stay home until you get your test result. Don't be out running around. If you felt poorly enough to get tested, please stay home until you get that test result. And if you've been quarantined or you're ill, please stay home. There's a couple of articles that just came out this week, one yesterday and one on Monday, from a journal called The Lancet. It's a European or UK medical journal that's highly respected. And so it came out with a couple of articles regarding COVID. Now, the European nations are a bit ahead of us in their pandemic response to COVID. And so we can learn from them and use that data and apply it to our patient population, to our people, and to make a difference here. So there's 2 articles I want to visit with you about. The first one looked at social distancing, what they called sheltering the elderly or the vulnerable. They looked at school closures and self-isolation. And they looked at those parameters and what effect it had on the pandemic disease, with the total number of cases, the total number of deaths related to COVID-19, the ICU admissions to hospitals, and the non-ICU admissions to hospitals. So if we take those 4 things that I mentioned earlier, the number one behavior that decreased every aspect of death, number of people infected, hospital admissions in the ICU, the number one behavior was social or physical distancing by 2 meters. Now we say 2 meters or 6 feet is what we say here in the United States, but actually 2 meters is a little bit further than 6 feet. So 2 meters, 6 feet, we'll call it good. So the number one thing that you can continue to do in that article is social distancing. The second article looked at non-pharmaceutical intervention. So anything related that does not include a drug. And they looked at physical distancing again, facial coverings, and eye protection. So when you wear all three of those, that was the best way to prevent transmission of the virus or stop the virus. So, and it verified the use of facial coverings, whether it's a face mask or a facial covering, any of those helped. The only thing that you probably don't have access to is a face shield like this, or what we call an eye covering, or something like ski goggles. So if you wear your face mask, your facial covering, and an eye shield, and the third thing they looked at was physical distancing, you are certainly less likely to transmit that virus to anybody else. So all that to say, number one, continue the social distancing. We must be vigilant about keeping our social distance from each other. Don't get in my space, and I won't get in your space. And then wear your face mask. Those are the two things that we can do the most to protect our patient population, or our people, our citizens of Lubbock. Wash your hands. We must continue to protect the elderly. Wear your facial covering and keep your social distance. That's all that I have today. I appreciate all the work that you're doing. You're doing a great job. We must continue to be diligent. You know, Texas Tech is coming back pretty soon. All the universities in our region are coming back pretty soon. We're already meeting with them to talk about best practices for their institutions and what they can do to help make sure that we don't continue or propagate this spread of the virus. I appreciate your time. Thanks so much. Mayor Pope, you're up.
Good morning. Thank you, Dr. Cook. It's great to be with you today, and I continue to want to thank Katherine Wells and Dr. Ron Cook for their leadership, and it's been great to serve on a public health team with the two of them. I want to start by sharing a few data slides, the same slides you're used to seeing. So if you'll bear with me for one moment. Okay. So 4 slides, the 4 we've been watching. Active cases by day. So remember, an active cases are total cases less recovered cases and deaths. The trend line on active cases continues to be very positive. You can see it's flattened a little bit. That's okay. We want to make sure that it's overall going the correct direction, and that would be getting lower. New cases by day. So we've been reopened in some form or fashion now for between 3 and 4 weeks. And we've been able in that entire time period to keep our excuse me for a minute. Hold on, I've been told you can't see my slides. Bear with me for one moment. Okay, I'm sorry. You get what you pay for when you get, as you know, with me as your technology person. So I think I did the narrative around active cases by day. I'll pause for a minute so you can look at it. Okay, let's look at new cases by day. And my point I wanted to make here was we've been 3 to 4 weeks now reopened, and we've kept our new cases in a range that I guess the most we've had is 12, which we reported on Monday of this week. We had one other time that in that period that we had 11. Other than that, they've all been less than 10. It's been a very manageable range. We can trace those cases. We can do the isolation, and we're doing very well in this regard. Our hospital data remains very strong. the blue line being hospitalized COVID-19 patients, and the top line being hospital capacity. And then finally, our tests versus new cases by date. So the blue lines being the number of tests that are done, great trend there, more and more testing. The orange line being the positive test on a daily basis. Remember that our percentage of positive tests as a percentage of overall tests continues to go down. That's a very good indicator. Okay, I'm back now. And my apologies for that little technical snafu. Let me make a couple key points. First of all, I believe that the West Texas way, common sense, good decisions have put us in a position where we can reopen safely. Thank you, all of you. Thank you very much. I'm thankful for our Lubbock Economic Recovery Task Force and their work. We have more than 825 local businesses who have self-certified that they are Lubbock safe, driving consumer confidence up, allowing business to restart. That is very, very important to our economy, to our small business owners, to the men and women who go to work in those businesses and count on those businesses to be able to put food on the table, to send their kids, to be able to send their kids to daycare, to be able to pay for college education. It's just critical. We continue to talk to some of you who have parents and loved ones in senior care facilities. We know that you are impacted by the fact that you can't see those people that you love so much and you can't hug them. We have taken, we think, important measures all based around safety of your loved ones. The state agrees with us. We were ahead of them on this, frankly, but we're in concert on this, as the CDC does on a national level. We will continue those protocols. We want to keep our most vulnerable safe. So what's our future look like? We're talking a lot locally, and we know it's in Austin, there's discussion about mass events. What do large events look like going forward? What does football look like in the fall? Dr. Cook mentioned school reopening. What does that look like? There's a lot of very good work going on to make sure we can do that safely. A lot of our time is being spent there. So more and more information will come out, and we will keep you posted on that. I want to wrap by talking about graduation. We've tried to keep these calls to public health. There have been many impacts in the last 80 days on our lives. We've had weddings canceled and funerals done differently, many things postponed, trips, events, many important things to our community. But probably like me, graduation is a big deal. And our colleges did theirs virtually in May, and they did a great job. I was particularly thought the Tech graduation with Pat Mahomes participating was really cool. This weekend, however, our high schools, our big high schools, will be having their graduations, and they'll get to do them live. They'll do them outdoors. They'll do them differently. But I think on behalf of all of our citizens, we want to congratulate our seniors. And we're thankful that they're willing to go about this differently. We're thankful for our school district leaders and their efforts to do this safely. I know, like you, that when I hear Pomp and Circumstance or Auld Lang Syne or Amazing Grace, those songs that really make us conjure up memories and good memories. And I'm just glad that we're going to be able to have those graduations this weekend. Finally, let's stay strong, Lubbock. We can relate good West Texas common sense decisions to our health. Let's keep doing the things that have allowed us to recover Let's stay the course. May God bless you all. Lacey, back to you.
Thank you, Mayor. Now we're going to open up for media questions, and we've had a little change in our media order. So media partners, the order I sent you, everybody is moving up one spot. So that means we are starting with Karen McKay with KCBD.
Good morning. I think we all watched the protest demonstrations or the march in Lubbock and saw some people were wearing masks and some people were not. So how long will it take for us to see a spike in cases, if there is one, because of a spread of the virus, because of the demonstrators being closer together?
Hi, Karen, this is Dr. Cook. So we say an average of incubation time is anywhere from 5 to 21 days, roughly. So it may take that long. Most of those are going to occur before that. So within the week, 10 days, maybe. So hope, you know, the good thing about it, it was outside. And so intermixed with people were wearing facial coverings. And so that was a good thing. And so, and hopefully people who didn't show, hopefully people didn't show up that were sick. So we expect the best of our citizens, and I know that they did well. So.
Also, I wanted to ask you that, probably Dr. Cook, I've noticed that some people are not wearing masks at restaurants or where food is served. Most are, though. But what happens now with health inspections when they go out? Will that be something that they write up if people who handle food are not wearing masks?
Currently, they're all supposed to be, if you're in the food service industry, all the employees are supposed to be wearing masks. And so we can leave that to the health department, that division that takes care of that.
Yeah, Karen, let me add to that. If a citizen has a concern, they need to call the non-emergency line at LPD. We'll send environmental health out if they think there's a problem. I ate out for breakfast this morning. I have a lunch meeting out. I find that the vast majority of our restaurants have taken this very, very seriously.
Okay, thank you, Karen. We've had a media member that was supposed to go first. She's able to join us now. So now we're going to go to Olga Aguero with El Editor.
Thank you. Good morning. A lot has happened here in Lubbock in different areas, and you know, events, special occasions, and then this walk that we had last night. But with that being said, I just want to say thank you to this group for still continuing updating us and keeping us up to date as for the COVID-19. If I missed the information, if it was given earlier, excuse me, but I was just wondering on the new cases coming in, are they coming in from nursing homes or businesses or community? Karen.
This is Katherine. I'm very happy to say that they're not coming from nursing homes. We are seeing more of them out in the community, as what we expected as more and more people are getting together and seeing each other and returning to work. We are going to see some of those cases of community spread. Good.
That's good, because knowing that the process has been testing for the nursing home and all that, so we haven't seen those numbers, or have we?
No, we have not identified any outbreaks or new cases within our nursing home facilities. So we're very pleased, and that testing is about 75% done.
Yeah.
Okay, thank you.
Thank you, Olga. Now we have Christie Martinez Garcia with Latino Lubbock.
Good morning, everybody. Dr. Cook, many people are feeling I think you called it the COVID alarm fatigue. And what's your best advice for those that are trying to stay the course, as well as those that, frankly, they no longer care? What can you encourage them to do to get back on track and avoid any more COVID cases?
So a couple of things there, Christy. You probably heard me talk about the 2 articles that just came out from Europe that's ahead of us in the disease process that show that facial covering and social distancing are the best things that we can do to protect our vulnerable patient populations, our elderly. So really, when you wear a face mask, when I wear a face mask, or Christy, when you wear a face mask in the public, it's not about protecting you. It's about caring for and protecting your fellow citizen. And so you could be completely asymptomatic and carrying the virus, but if you wear a face mask, the likelihood of transmitting that virus and keeping that social distance, the likelihood of transmitting that virus is significantly low. If you don't wear a face mask and you go out and you encroach on that 6-foot space, you're very likely to transmit that virus to somebody else. So as long as we continue to do that and think it's not about me, it's about because I care about you, that I don't want you to catch that virus that may kill you. I have no idea if I give you something, give you that virus, whether or not it's going to kill you or not. Literally kill you. So as long as we keep that in mind, I care about my fellow citizens enough to respect the distance between us, and to wear that facial covering.
Mayor, becoming jobless during the coronavirus pandemic has caused some families to go into more debt because of the crisis. One of the top Google search increases has been loan searches, including payday loans. And in the past, this subject has come across your dais. As policymakers, is there anything you can do to protect our citizens from these payday loans so that this pandemic's not going to make their livelihood a longer struggle as they strive to make ends meet?
Here's what I would suggest to a family that's struggling with COVID-19 and the financial impact. I would suggest that they call 311 and ask to be connected to community development. We have a number of resources that are available, some that are available every day, but many of them are available as a part of the federal action around COVID-19. Those include utility bill payment assistance. They include rental assistance. Hopefully early next week, we will be able to put in place some assistance for people that are trying to pay for childcare. We've already done one series of business loan grants. I think you'll see another effort from us very soon. That's what I would suggest. I think that's where our families need to be going. There are dollars available today to help our families that are in need.
Thank you, Christy. Now we move on to Matt Stell with KMAC.
Thanks, Lacey. My first question is for Katherine Wells. Katherine, it's been over 2 weeks since we've had a new community or an additional community exposure location. Does that tell us that businesses are doing their parts in making sure that customers or employees are safe?
Yeah, I think I'm very proud of our business community here. I think they've done a great job at keeping employees safe, customers safe. A lot of the exposures we're seeing right now are among families. So someone that might have picked it up at work or an outside environment, travel, and brought it home to their family.
Gotcha. Question can either be for Dr. Cook or for Mayor Pope. I had a senior from Friendship reach out to me this week and said, I'm graduating this weekend, but I don't really want to wear a mask. It's going to take away from my cap and gown. So for those seniors this weekend, I'm assuming you say they should still wear a mask, even though they'll be somewhat social distancing.
Absolutely. I think you probably heard what I said. It's, wearing a mask certainly decreases the likelihood of transmission of that virus along with social distancing. They come in all shapes, colors, and sizes. I bet we can find one, or individual can find one that'll match their cap and gown. So be resourceful. There's plenty of opportunities out there to find something that'll match and look good. Put your high school logo on the front of it.
Thank you, Dr. Cook.
Okay, thank you, Matthew. Now we have Terry Furman with KOBK.
Hello, everyone. So my question is this.
Terry, we lost you. Can you try it again?
Are we looking at a trend in Lubbock? Some of these smaller mom and oh dang. Hello, I'm here. Can you hear me?
Yes.
I got you now. Yes.
Okay, very good. So my big question is the fact that we've lost several mom and pop home-owned businesses here in Lubbock. What is the forecast of losing more of those due to coronavirus?
Yeah, I'll take that. It's a great question, Terry. It's something that's on my heart and mind. I think it is all of ours. I don't know what the forecast is. I know after spending 20 plus years as a small business owner myself, I know that life as a small business is tenuous. There are days that you wonder if you'll be able to open the door the next day. We are doing all we can to make sure that the aid that's available to small business gets to them. And we're doing what we can to reopen safely so they can get their business back. We will see sales tax numbers next week for the month of April. We'll see those, I believe, next Wednesday. The state numbers, we saw an overall number this week. It was not as bad as what we had thought it might be. We'll also get a new unemployment read in the next week or so. And so we're going to comment a little bit more on that, but I can't project business failures. All we can do is go to work every day to try to create an environment where our businesses can succeed. And I'm committed to that.
For sure. Now, my second question, and it's hard to predict as well, but college seniors graduating from tech, how are we as Lubbock trying to keep them here with the current coronavirus crisis that we've seen?
Yeah, it's a great question. In fact, I had a conversation at both breakfast this morning and late yesterday afternoon on the phone about this very topic. I think if you look at our large employers, we don't have layoffs. We've got robust, in fact, many of them are trying to hire people. I think some of those businesses, many of those businesses have jobs that are attractive to men and women who are finishing college. I also believe that cities like Lubbock, where we are socially distanced by nature, and frankly, pretty thankful for that, where we don't rely on mass transit to get us around, where we can afford to have backyards where our kids can play safely, neighborhoods where they can walk to school. I think we stand to be big beneficiaries of New America. We've got a great art scene. We've got a Division I university that's got great sports and arts and all that goes along with that. We've got a great airport, good air service. So I think Lubbock becomes a winner. It's hard to be a bigger winner than we already are. It's not about wins and losses, but I think the future is very bright for us. Thanks for allowing me to do that commercial.
Thank you, Terry. Now we have Brady King, Fox 34.
I agree.
Good morning. My question's for Mayor Pope. We've heard today and the past few months on these news conferences the importance of social distancing. Why did you participate in the Solidarity Walk 2 nights ago? And are there any concerns about large gatherings of citizens that are happening right now?
Well, certainly there are concerns about large gatherings. We've talked about them on this call today and for 80 days. I participated on Monday night because I thought it was the right thing to do. We need to protest what happened in Minneapolis. We need to change things. We can protest peacefully and with cause, and we have proven that in Lubbock, starting last Friday night and running through last night, and we're not finished. I wore my mask as I was walking. I felt like it was the right thing to do. I didn't pause when Bill Stubblefield asked me to help lead it. I didn't pause before I said, yes, I'll be there.
Great. Thank you, Mayor. That's all I have.
Thank you, Brady. And now we have Matt Donray with the Lubbock Avalanche Journal.
Hey everyone, good morning. Mayor Pope, you mentioned nursing homes and you mentioned high-risk facilities. Do you think there's any way those facilities start to open up without a successful vaccine? And if so, what do you kind of envision those facilities? What do you envision that looking like?
You know, Matt, I've not been part of any of those type discussions. I would hate to harbor a guess on something like that. I'll kick this to Dr. Cook, see if he has anything to add to it. Ron?
Say, Matt, I don't have anything either. We know that those patients, that patient population, especially the population in the nursing homes and long-term care facilities, are extremely vulnerable. And we have evidence of that at the very beginning of the pandemic here in Lubbock, where we lost a number of individual loved ones because of the pandemic and because the infectiousness of this disease. And it can spread rapidly. We think that we've done some things to mitigate those factors where it won't spread like that, but it's still too early to know to whether or not we can open up safely. And it only takes one person, because of the proximity of the individuals in those environments. We put them there to protect them because we either can't take care of them at home or they can't take care of themselves. And they're put there so they are protected. And the last thing that we need to do is lower the safety margin that they have because we put them there for their protection. And so we'll just have to wait and see.
Yeah, thank you. And Ms. Wells, I was just kind of curious about your operations. I know at one point you said you had, I think it was 25 contact tracers, and you just kind of described how at City Hall it was kind of all hands on deck and you have people from various departments helping the health department. Is that still the case, or have you kind of scaled back some of your operations?
We're still getting lots of support from different departments to help at the health department. We're looking at expanding some of partnerships to increase contact tracers. One of those is possibly working with Texas Tech as we start moving individuals onto campus, as we start seeing more students in town. And we're also looking at some other contracts to, again, expand that workforce so that the city can have their business and we can also continue with the health department's needs.
Matt, I'm going to jump in on that. We're committed to testing, tracing, and then doing the right kind of isolation. And we're going to continue to do that. And that's not something that we're going to quit tomorrow, next week, or next month. Until there's a vaccine, that's the business we're going to be in.
Very good. Thank you.
Okay. Thank you all. Thank you all for joining us. Thank you to our panelists and our interpreters. Remember, we have all the resources available at mylubbock.us/COVID-19 for all the information and graphs on the coronavirus in the community. We'll see you next week at our next scheduled press conference.